The 2013 Fine Awards for Teamwork Excellence in Healthcare. Gold winner. Highmark. Enhancing care at end of life through advanced illness services.
When we look nationally at what Americans say about what they want at end of life, the overwhelming majority want to be at home, surrounded by loved ones, and have their pain and symptoms controlled. In 2000, for our Medicare Advantage members, those individuals who died, only 20% were in hospice, and half of the individuals would die before their 8th day of receiving hospice services. So we knew that conversations weren't occurring, and when they did occur, they occurred late. Advanced Illness Service is a program for our Medicare Advantage members who are facing life-limiting illness. And what is offered to our members are a health coach that has expertise in dealing with advanced illness, and also services provided by hospice.
The program is called Advanced Illness Services, and it's available to you at no cost with no copay or out-of-pocket expense. What you have is 10 lifetime consulting visits from a contracted agency where a medical social worker or a registered nurse can come out and talk to your family about other supports and care options that you have available to you in your community.
This is Jan. She's the nurse from the Advanced Illness Services program.
How are you? Good to meet you. Your case manager from Highmark thought that this program might be helpful to you. Can you tell me a little bit about what's been happening with you?
Well, I get short of breath and get worried, and my wife is worried too. But we call the doctor, and they usually tell us to go to the emergency room, and then they send me back home. I'm getting sort of tired of that.
I'll bet you are. You know, it sounds as if it might help if you were able to have a nurse see you on a regular basis and maybe be available to call and talk to her when these things come up, and might save you having to go to the emergency room so much.
Good.
The AIS program could have a social worker come to talk with you about maybe some other services to provide some transportation or housekeeping help. The other thing I'm wondering about today is I wonder if you've given any thought to what you're going to want for yourself as your illness progresses.
I've been thinking about that sort of thing recently, and I don't know how to sort it out.
In the interim, though, I do want to leave you with a couple of brochures and things that maybe you would like to look at and talk to your family about.
We have individuals who've had personal experience with this program, like Jim Fawcett, who recently lost a loved one.
So the beauty of having access to a professional in an advanced illness services program was we would all kind of debrief on what we'd heard, and we suddenly realized we all heard the same thing differently.
And Advanced Illness Services made such a difference in helping him and his family with the conversations and navigating the healthcare system. And you've heard that it takes a village to raise a child. Well, it takes a village to develop a program like this.
One of the things that I think is most important about the program is the dedication and compassion of the staff.
So they are our bridge between the health plan, the member, and the provider. We looked at outcome metrics that you study when you look at end-of-life care. Increased use of hospice, up to 75%. That median length of stay is up to 34 days. In addition, member family satisfaction, over 95% positive response.
And because we worked with the Advanced Illness Service program, I think it was a smoother path for all of us, including my father, of course, but can't do it soon enough.